Advanced life support in patients with severe trauma constitutes the cornerstone of emergency medicine, addressing injuries that directly threaten life and require immediate interventions. This set of maneuvers integrates rapid and prioritized assessment through the ABCDE approach, hemodynamic stabilization, and hemorrhage control, aimed at ensuring survival during the golden hour. Rigorous application of these principles significantly reduces early mortality and improves long-term outcomes in critically ill, high-complexity patients. The excellence of this procedure lies in the specialization and precision with which interventions are executed. Advanced airway management, assisted ventilation, volume replacement with fluids and blood products, and surgical hemorrhage control require rigorous training and a deep understanding of trauma pathophysiology. The application of innovative techniques, such as permissive hypotension or the use of antifibrinolytics within international protocols, reflects clinical leadership based on scientific evidence and adapted to the current demands of emergency practice. The future of advanced trauma life support is oriented toward integrating continuous monitoring technologies, developing more dynamic triage systems, and improving coordination between pre-hospital and hospital units. These innovations, combined with continuous training and protocol refinement, consolidate this field as a symbol of prestige and scientific excellence. Thus, advanced life support in patients with severe trauma is reaffirmed as an international benchmark of innovation, leadership, and commitment to health in the most critical scenarios.